Dr. Michael Barnes here, board certified psychiatrist. Magnesium, there's like 7 different kinds. We're going to sift through that today. Back in medical school, we were taught that you can order magnesium through the serum in the blood. And in fact, that's true. You can order magnesium levels as an electrolyte, just like we order any electrolyte. But it turns out that's not the whole story. When we measure the magnesium in the blood, it's only a small percentage of the magnesium that's found in the body. And the larger percentage is in the intracellular compartments inside of tissue, like bone, for example. And the body has a mechanism to grab that magnesium and keep the serum magnesium normal. So even if you do a blood test and the magnesium is normal, it could be that your intracellular and certain soft tissues are deficient. And that's where these supplements may or may not come in. The problem is there's not a good, reliable test to measure intracellular magnesium. So we often rely on clinical status, symptoms, and similar. So let's jump right in. Let's go. Start from the top. Glycinate, magnesium glycinate is probably the most popular one. I like to group these 3 first. There's glycinate, magnesium malate, and magnesium threonate, okay? And I like to group these because these are highly absorbable. You have to look at these as how they are absorbed and to what degree they're absorbed. So these are highly absorbable and often studied in mental health. Glycinate being the favored for anxiety, for example, or sleep. Okay, but I've also seen the malate being used in certain things like fibromyalgia. Remember, highly absorbable. And I saw some interesting data recently as I was looking this up on threonate being also very helpful in cognition and crosses the blood-brain barrier in very specific ways. So this may be good for some cognition. Moving on, citrate and oxate. These ones I also kind of group together as GI support or gastrointestinal support, okay? And I want you to think of these ones as not being absorbed as good as potentially these ones, but also because of that can be harnessed to help with things like constipation. And you may have heard of milk of magnesium, MOM, which is magnesium oxide. Okay, which again can be used in constipation and good for overall GI support and GI health. Now, there is a couple other ones. Chloride. Chloride is another, magnesium chloride is another one that can be used to treat low magnesium. And I guess what makes this one a little special is that it does come in a topical form, in the form of sprays and oils. So this is a good medication also that can be used to treat low magnesium, but has the added benefit of coming in these topical forms. And then magnesium sulfate, this is the one, fun fact about this one, this is the one that's actually the ingredient in Epsom salts, if you're familiar with those. But generally speaking, we will use this one via IV in hospital settings and other settings. We use it, for example, preeclampsia and some cardiac arrhythmias and other things is what we use it for. So I hope this didn't confuse anybody. Hit me up in the comments.